We're here at the International Conference here in Vancouver, BC. We're here with Asier, who has brought to the conference a very remarkable happening, an experience here that you had at the Institut Pasteur with a remission of a child. Well, it's not a child now, but explain how this worked out in timing with this remission.
Yeah, so this is the case of a young girl. She's 18 years old now. She was infected perinatally, but at the end of the pregnancy of her mother or at the time of delivery. When she was born, she received a prophylactic treatment because viral load in the mother was not controlled. And unfortunately, this prophylactic treatment that was kept for 6 weeks was not efficient to avoid the infection on this girl, as was observed when the viral load went up after the interruption of the prophylactic treatment. So an antiretroviral, combinatory antiretroviral treatment was initiated when she was 3 months old.
So there was intermittent treatment or an unsuccessful treatment for 3 months?
Yeah, it was for the first 6 weeks. There was the prophylactic treatment. This is done to avoid the transmission during delivery.
Because you're not sure whether
whether this could happen. So unfortunately, this girl was infected. We don't know if it was just before delivery or at the time of delivery, despite the presence of the prophylactic treatment. But in any case, at 6 weeks, this treatment is interrupted, the prophylactic treatment, and the viral load went up to very high levels. So it was decided that a new combinatory antiretroviral treatment was going to be initiated right away. And this was done when this girl was 3 months old. And this treatment was kept for roughly 6 years, at which time the girl was lost for follow-up for a whole full year. And when she came back, she hasn't been taking the antiretrovirals for a few months. And what was remarkable was that the viremia was still controlled despite the absence of antiretrovirals. It was decided that because the viral load was completely controlled and the clinical parameters were perfectly normal, that there will be a close monitoring, but then antiretroviral treatment was not going to be reinitiated. And so this has
that would seem reasonable to do at that time.
Yeah, because we are talking about the early 2000s.
Right.
And so this girl has been in remission of infection for the last 12 years. And we can detect HEV DNA in the cells, so the virus is present in the cells, but we cannot detect any viral replication, even using very sensitive techniques. So the virus is present, but extremely well controlled.
So this is an immunologic success. Or would you call it a virologic? Or do you think it's the host or the virus?
I think that it's probably a combination of several factors. We believe that the first step in this path to remission in this girl is early treatment initiation, and the fact that the treatment was kept for several years. At the very beginning, when she was treated, there were 2 episodes in which the antiretroviral treatment was not taken as it should, and the viremia went up again. So this girl was not able to efficiently control the infection during the very first months of life.
So her virus was seeding the body. all the cells.
But it was very punctual. So it was just 2 single episodes, and what we don't know is if this actually, as I said, early treatment and then the length of the treatment, because after several years she was able to control the infection. So is this period during which there was some contact with the virus helping to experience the immune system and then contributing to the control afterwards? That's something that we don't know. In any case, early treatment, we know that it's going to limit the establishment of the reservoir and decreasing this reservoir with the length of the treatment, and probably this is the first point, but then we are convinced that there are factors in this particular girl that are helping her to control the infection after the interruption.
A unique host, maybe.
Yes.
Sort of, yeah. Well, I'm very hopeful that we will learn something from this. We hope it's not just a super unique situation. We hope that there's something we can learn to apply to other youth and other individuals.
Yeah, I think that what this is pointing us is to early treatment, as I said, as a first step. We know that we reported a couple of years ago about adults that also achieve remission of HIV infection for many, many years. In the case of the adults, the common characteristic was also that the treatment was initiated very early. So we know that early treatment is not the the only, it's not sufficient to achieve remission, but it seems indeed to be the first step. And well, we hope that starting from there, we will be able to extend this to many other patients.
Right. It's just a difference between maybe an infant immune system and an adult.
This
immune
was
system.
what was quite remarkable. After the Mississippi baby, there was the possibility that this kind of remission could be achieved, but it was 2.5 years till silus control, and we were unsure whether this could be sustained for many, many years. Now we know that it can be, and so the proof of principle is there, and that even in children or in adults we can achieve durable remission, and the parameters associated to that seems to be quite common between all them.
I'm excited, and I think there are a lot of other people here at the conference that are too, and definitely want to follow this one and do all what you can to learn from this particular experience.
Yeah, absolutely. This is what we need to do now, is to better understand the mechanisms associated to the remission of infection, so that we will be able to extend this to other patients, because right now we know that most patients that interrupt the treatment are going to rebound very, very quickly, and this has very negative effects. So we need markers to identify the patients who are more likely to achieve remission, and to better understand the mechanisms so that we can find means, therapies, to extend these mechanisms to other patients.
I'm one that's really keen on trying to find all the markers. You can really understand, define what it is that's going on.
Yeah.
So I'm very, very appreciative that you're doing that work. Yeah. Thank you very much.
Thank you.
Thank you, Asier.
Thank you.